Brugada syndrome, overview. Brugada syndrome is a rare, inherited cardiovascular condition that affects the heart's electrical system. It can lead to life-threatening arrhythmias, irregular heartbeats, and is a significant cause of sudden cardiac death in individuals with structurally normal hearts. Key features. Inheritance. Brugada syndrome is inherited in an autosomal dominant fashion, meaning a single copy of the mutated gene from one parent can cause the condition. It has an estimated prevalence of 1 in 5,000 to 10,000 people and is more common in Asian populations. Genetics. Around 20 to 40% of cases are linked to mutations in the SCN5A gene, which encodes the myocardial sodium ion channel protein. This mutation disrupts the normal flow of sodium ions, affecting the heart's electrical activity. Electrocardiogram, ECG, changes. Type 1 pattern, convex, coved, ST segment elevation greater than 2 mm in leads V1-V3, followed by a negative T wave. Type 2 and 3 patterns, saddleback-shaped ST segment elevation, which is less specific. ECG changes may be more apparent after administering sodium channel blockers like agmaline or flecainide, which are used as diagnostic tools. Symptoms. Many individuals are asymptomatic. Symptoms, when present, include fainting, syncope, palpitations, seizures, sudden cardiac arrest, often during sleep or rest. Diagnosis. ECG findings. The hallmark is the Brugada pattern, most prominent in leads V1-V3. Partial right bundle branch block may also be observed. Provocation test. Administration of sodium channel blockers, agmaline, can unmask the Brugada pattern in suspected cases. Genetic testing. Identifies mutations in the SCN5A gene or other related genes. Management. Implantable cardioverter defibrillator, ICD. The primary treatment for preventing sudden cardiac death in high-risk individuals. The ICD monitors heart rhythms and delivers shocks to correct life-threatening arrhythmias. Lifestyle modifications. Avoid triggers like fever, excessive alcohol, and certain medications, example sodium channel blockers, antidepressants. Medications. Quinidine may be used in some cases to reduce arrhythmias, especially when ICDs are not an option. Teaching example. Imagine a 35-year-old male of Southeast Asian descent presenting with fainting episodes during sleep. His ECG shows a coved ST segment elevation in leads V1-V3. After administering agmaline, the Brugada pattern becomes more pronounced. Genetic testing confirms a mutation in the SCN5A gene. He is diagnosed with Brugada syndrome and receives an ICD for long-term management.